This is indeed a very pleasant particular between India and Sweden, the partnership that has grown to this level. To start with, we are extremely pleased to have Dr. Vardhan, Minister of Health and Family Welfare, Minister of Science amongst us. We are also extremely happy to have Ashwini Kumar Chowdhury amongst us. We are from Sweden. We are so happy to have Dr. Maya Fested, 10 years of our collaboration between India and Sweden on the area of health, and also from Sweden who are here on a 5-day visit to India. Welcome once again. Introduction for our Secretary Preeti Suzanne, but I'm sure everyone knows her. She has been so instrumental. We have to have this collaboration enhance and grow more and more. Welcome, ma'am. I would also like to welcome Professor Balram Bhargava, Secretary and Director General of ICMR, still in collaboration with Sweden in the area of research and focused on elderly care. Thank you so much for your presence here. I would like to also introduce my Saturday afternoon. Please, Amrit Hinduja from...
Thank you, Yasmin. Today's some larger celebration of cooperation and a dialogue between India and Sweden, and therefore I'd like to welcome the Speaker, Trade Commissioner of Sweden to India, to deliver the opening remarks.
And positive effects on both Indian healthcare system and also on the Swedish healthcare system. We do this in Sweden through collaboration and co-creation. Collaboration between this on the Swedish side in what we call a triple helix formation, jointly government, industry and academia addressing some of the major challenges within many areas, healthcare being one of them. We also do this to co-creation, and this is where the collaboration that we value so much with India kicks in. We look forward to another 10 years of even more and accelerated innovation together. The key word of these days from an innovation perspective has also been frugal innovation, and we look forward to bringing more healthcare to the masses in India and also bring some of the innovations that are done here to the Swedish and world markets. With that, I thank you all dignitaries for joining today. Thank you all in the audience, and I look much forward to a great afternoon together.
Ladies and gentlemen, put your hands together for these 10 years in the field of health, as well as the closing of the 2019 India-Sweden Year of Health. On behalf of the Swedish Ministry of Health and Social Affairs, I want to thank Business Sweden, Swecare and the Swedish Embassy and everyone else involved for all your work in organizing this event. I have had the pleasure to co-chair the joint working group overseeing our bilateral MOU in the area of health the last 8 years. Together with my counterpart and fellow co-chair, Joint Secretary Mr. Lav Agarwal, we are happy to highlight some of the achievements of the last 10 years. Sweden and India share a long history of strong and excellent bilateral relations in health, already since the 1960s. The development cooperation has, since the MOU was signed in 2009, transcended into a partnership based on mutual interest and benefit. And today we're here to celebrate the 10 years completion of our joint work, a work that has been very successful. What are the reasons for the success? I would like to start with emphasizing the importance of commitment and shared values. The strong commitment on the political level has also been of great importance. As you also saw in the film, the elections and shifts in government and staff in both our countries have not affected the political priority of our collaboration. Another important factor for the success is the basic construction of the MOU and its three pillars of public, private and academic. We can see that over the years, research collaboration has flourished, policy exchange between governmental agencies have been initiated, as well as increased trade has come to happen between our countries. This is also reflected in the Swedish delegation being present here today with representatives from the governmental agencies, the research community, as well as the private companies. The 2019 India-Sweden Year of Health took off with a visit earlier this year to Delhi in Jodhpur by the Swedish Minister of Health and Social Affairs, Mrs. Lena Hallengren. Many new areas of collaboration is now underway. As an example, the Swedish Public Health Agency in May signed a letter of intent with AIIMS Jodhpur on, for instance, health policy and implementation research. Since long we have had cooperation with the NCDC within the area of antimicrobial resistance, and this has now been widened also to Safdarjung Hospital here in Delhi. Through the year we have had a number of knowledge exchange visits both ways, including a visit to Sweden by Secretary Preeti Sudan. This morning, Her Majesty Queen Sylvia participated in a seminar on aging and dementia at AIIMS Delhi. At the seminar, ICMR presented research from the ongoing cooperation together with Forte on research on aging and health. Similarly, the Swedish Medical Products Agency has since long cooperated with CDSCO. Clinical trials and medical devices are areas identified for intensified cooperation. One of the most prominent areas for collaboration have been maternal and child health, with focus on strengthening of midwifery and comprehensive abortion care with Swedish universities such as Karolinska Institute and Uppsala University as partners. Adolescent health collaboration has also taken place between the National Institute of Health and Family Welfare and MANTA in India and Lund University in Sweden. Notable Swedish companies like AstraZeneca, Getinge, Elekta, Hemoq, Bactiguard, to name a few, have contributed to their technologies and has entered into long-term commitments with India. And the list could go on and on. To conclude, a lot of important work has been done during the last 5 years, and I'm convinced that a lot more can and will be done in the years to come. Interests have been expressed to cooperate in areas like NCDs, cancer, diabetes, etc. And I'm happy to note that some corporations are getting initiated today. Today's conference provides an excellent takeoff for our future work, and from our side, we remain committed to take our cooperation to even greater heights. I now leave the floor to my co-chair, Mr. Lad Agarwal, to share his experience of the cooperation.
Thank you, Nicholas. Honorable Minister for Health and Family Welfare, Dr. Harshvardhan Sahab, Honorable Minister of State for Health and Family Welfare, A.K. Chaube sir, Ms. Maya Festad, State Secretary for the Ministry of Health and Social Affairs, Government of Sweden, Secretary Health, Mrs. Preeti Sudan, Secretary PHR, Dr. Balram Bhargav, members of the visiting Swedish delegation, officials from Indian government and delegates. Foremost, I would like to thank the Swedish delegation for this informative film on the Indo-Sweden Year of Health. It truly reflects the spirit of our cooperation. As my fellow and counterpart, Mr. Nicholas Jacobson has already informed you, India and Sweden commenced this journey of collaborating in the field of public health in 2009. Now, a decade later, We are celebrating all the successful work we have done together and look forward to forging new and novel collaborations. Behind this successful collaboration, as already pointed out, has always been the positive intent to work together, which is shown by the fact that not only the joint working group established under the MOU met 10 times in the past 10 years, but also by the fact that India and Sweden have forged close cooperation at the ministerial as well as the presidential level to align the vision between two nations when it comes to health. In 2012, it was the then Swedish Minister, Mr. Göran Hägglund, who visited India to set the context for the work under the MOU. Thereafter, in 2014, Swedish Minister Gabriel Wikström, accompanied by a large triple helix delegation, visited India to celebrate 5 years of our cooperation and had discussions on the way forward for our cooperation with the then Indian Minister for Health and Family Welfare, Shri J.P. Nadda ji. In 2015, the President of India, Shri Pranab Mukherjee, visited Sweden to take our cooperation to health to new heights with new MOUs on aging and pharmaceuticals. Very recently, in 2019, Honorable Swedish Minister for Social Affairs and Health, Ms. Lena Hellengren, visited India, a visit that sparked a new enthusiasm for more collaboration, which our nations are in the process of exploring. While my counterpart, Mr. Niklas, has already given a comprehensive overview of the successful and impactful work we have undertaken together, I must reiterate some of the critical areas of collaboration so far. Our partnership in capacity building of nurses and midwives for maternal and neonatal care, public health policy, health system strengthening, and delivery of adolescent-friendly health services has been noteworthy. While this work has been done, we must focus our energies on all the other key areas where we can work together. Much has changed since the MOU has been signed. The disease pattern and prevalence are shifting from communicable to non-communicable diseases. Critical indicators like nutrition and reduction of neonatal mortality has improved substantially, and overall Indian health system is moving towards preventive and promotive care. It is at this time when Government of India has put focus through Ayushman Bharat, that is Long Live India, and its focus on universal health coverage, that a true transformation has taken up in India. We look forward that we understand that these are the novel opportunities for undertaking our collaboration further with international partners, and we hope to continue our collaboration in this regard with Sweden, which is one of our strongest bilateral partners in health. AMR stewardship and infection control is a focus area for us, and I am glad to inform that already there is a memorandum of intent between National Center for Disease Control and Swedish Public Health Agency in this regard. Similarly, with respect to better management of lifestyle and availability of advanced screening, critical areas like NCD, Sweden has made substantial strides, and we hope to learn from it. While a letter of intent has been signed between AIIMS Jodhpur and Swedish Public Health Agency for Public Health Policy, Data Management and Analysis, NCDs and Lifestyle Management, we are excited to start working under it. India also recognizes the potential of technological transformation of healthcare, and therefore another area of immense interest is digital health and innovation. We are glad that Honorable Swedish Minister for Social Affairs and Health, Ms. Lena Hellengren, visited India for the 4th Global Digital Health Partnership Summit. We are keen to explore what India and Sweden can do together in the digital health, especially in the application and optimization of emerging technologies in healthcare. India is re-emphasizing the digital health agenda at the multilateral level, and we are proposing to establish a hosted partnership on digital health at the WHO for taking forward the global digital health agenda and focusing on catalyzing individual nations' journey towards a digitally enabled health ecosystem. We invite Sweden to be a co-sponsor of this endeavor and support India in making digital health a global priority. While exploring these new areas, we should also focus on enhancing our existing partnership. We are excited to build upon the good work we have already done in capacity building, training of nurses and midwives, elderly care, maternal child health, and we look forward for new partnerships or extensions or re-energization of these existing partnerships. At the end, I would like to state that the past 10 years of health cooperation has brought our countries significantly closer. Both countries are committed to tackling global challenges and moving towards universal health coverage. With a focus on innovation and strengthening of partnerships, we look forward to the coming 10 years of Indian-Sweden cooperation on health. Thank you.
Of India, Honorable Minister for State, Government of India, Shri Ashwini Kumar Chaubey ji, colleague secretary from Sweden, Dr. Maya Fested. She is Minister for Health and Social Welfare both. It couldn't be more apt, ma'am. Dr. Balram Bhargav, my colleague secretary, health research, Nicholas, and his entire team of our esteemed guests from Sweden, our two directors of AIIMS Delhi and Jodhpur, and ministry officials and the Indian members who are present here, who have been collaborating with Sweden. Good afternoon to all ladies and gentlemen. Once again, I'd like to extend my invitation and my, I would say, welcome to this delegation led by the major cities. And you have taken out time of 5 days to visit our precious country, and it only highlights how important this collaboration is. We've had a decade of formal collaboration, and it has been highlighted that the MOU was signed in 2009. But ladies and gentlemen, I'd like to take you back to actually 1960s. The Swedish assistance to India in the sphere of healthcare dates back to 1960s, specifically for the India Population Project. In the 1970s, this aid was expanded to include provision of testing facilities to more than 1,500 healthcare facilities. From 1978, Sweden also provided assistance to our 3 national programs on malaria, leprosy, and TB control. So you see, it's not only these 10 years that we are celebrating, but the collaboration has been way back from the 1960s. And as Nicholas said, irrespective of the governments, it is the 2 nations who have found that they need to work together to actually improve life of people in both the countries. I'd like to highlight a personal experience of Sweden. I was there in last August as Vice Chair of PMNCH. We had our board meeting. The board meeting was hosted by Sweden. I not only came back with pleasant memories of our stay there, but brought back a lot of learning which was translated into action. The first and most important was that the Swedish model of midwifery actually was something that India needed to emulate, especially because under Ayushman Bharat, when we are moving towards comprehensive primary health care, we need to keep our focus on the continuing agenda of maternal newborn child care, and which can be strengthened through the midwifery program. So I thank Sweden for our collaboration on this important program. Actually, between August and December, it was in December that we actually already sort of launched this midwifery program. So I'd like to say that this is one of the MOUs where it's not just words, but it is also action. And secondly, I had visited Karolinska Institute, and I'm very glad that my vision was that Karolinska should actually take up at least one AIIMS as a twin institute, so that collaboration not only on clinical but also on research, on knowledge exchange programs should actually begin. So here we are. We saw in the film also Dr. Mishra, the director AIIMS. The collaboration has actually translated, and I must also highlight that the Honorable Minister from Sweden visited Jodhpur, spent a lot of time in AIIMS Jodhpur, and the whole exercise has actually borne fruit. Is something which is personally and professionally very satisfying for me. I will not repeat what Nicholas and Love Agarwal have already said on the various milestones, that we have covered together. The CDC, our NCDC collaboration, our collaboration with ICMR and Fort, then now the latest that we are doing with AIIMS Delhi, AIIMS Jodhpur, and the Swedish government. I think these are some examples which we need to emulate for other countries also. And most importantly, since the present secretary is also secretary for e-health, I'd like to reiterate what Love Agarwal said. You see, digital health is the future, and we would really request, and I have made that request to the secretary personally also. We would like Sweden to consider co-hosting or I would say sponsoring a hosted partnership within WHO on digital health, because that is the future. And given the size of our population, the diversity of our population, until and unless we leverage digital health as an ecosystem, not only as an IT system, I think we can't move forward. And I'm very glad that there has been positive affirmation on this. We can work out the nitty-gritty of it. So, ladies and gentlemen, in the presence of our honorable ministers, I again thank Sweden for this very, very productive and collaborative partnership. And as was also reiterated in other forums, I think the USP of this partnership is that it's not only about governments, it's about academia, it's about industry, it's about knowledge exchange, and it's about people at a personal level also. So I'm sure that we will have many, many more occasions to celebrate. Thank you and all the best.
Thank you so much. Minister for State, Secretaries, Excellencies, ladies and gentlemen, dear friends. It's an honor to have the opportunity to say a few words on the marking of the India-Sweden Year of Health. And I thank my colleague from the Indian government, Mrs. Priti Sedan, for her speech highlighting many important features of this cooperation as well as her personal experience of it. And I believe that no one has missed by now that this is the year of the India-Sweden Year of Health, and that we also celebrate 10 years of successful collaboration. So congratulations to us. And I think what's special of this memorandum of understanding is that it has been persistent and very successful. And the MOU on cooperation was signed in 2009, and it is of course in itself a testimony on how our relations have developed and deepened. As we have seen and heard already here today, the broad cooperation of public agencies, universities, hospitals and the private sector, many of these stakeholders participated with us here today, bears evidence of the broad scope and depth in this cooperation. And it is indeed a blessing to have so many people working towards the same goal, exchanging ideas, sharing and learning. But what I really think differs from most other MOU is the persistence. Because, well, there have been constant exchanges and developments, and the joint working group has been meeting every year. Well, governments, ministers and state secretaries, they have changed several times during these years, as we do in politics. But the cooperation has kept on evolving. The Swedish government gives this cooperation with India a very high priority and value India as a partner whose role in the world increases continuously. India and Sweden share values of democracy, freedom, and the aim of providing welfare to our entire populations. We share the commitment to the global goals in Agenda 2030, as well as a strong partnership in this important field of healthcare and public health. And I am impressed by the efforts of the Indian government to increase the coverage of healthcare to hundreds of millions more citizens, and of the effort to strengthen primary care by introducing 150,000 new health and wellness centers, a fantastic task to endure. I believe that this development and the rapid expansion of new technologies and e-health solutions, as mentioned by my colleague, in both our countries give opportunities for increased cooperation in the years to come. Earlier today, we held a seminar on aging and dementia together with Her Majesty Queen Sylvia of Sweden. Aging populations is another scope for developed cooperation. cooperation. And in this seminar also the importance of health data and registers in elderly issues was mentioned as well as a field of cooperation. AMR, antimicrobial resistance, is another area in which we share expertise and knowledge between our authorities. And this is a highly prioritized area for both Sweden and India. And I look forward to listen to the rest of these speeches, and I look forward to sharing this day with you. Thank you so much.
आज डिप्लोमेटिक कॉन्क्लेव में आए हुए सभी प्रतिनिधियों को मैं भारत की ओर से हार्दिक अभिनंदन करता हूं। अतिथि देवो भव, आप सभी हमारे अतिथि हैं, गेस्ट हैं, आप सभी देवता के समान हैं। भारत के माननीय लोकप्रिय स्वास्थ्य एवं परिवार कल्याण मंत्री माननीय डॉक्टर हर्षवर्धन जी, सुश्री माजा जी, स्वास्थ्य एवं सामाजिक मामलों के मंत्री, स्वीडन सरकार के राज्य सचिव, श्री निकल्स जी, स्वास्थ्य और सामाजिक मामलों के मंत्रालय, स्वीडन सरकार के उप महानिदेशक, श्री मोलिन जी, भारत में स्वीडन के राजदूत, स्वीडिश प्रतिनिधि के सदस्यगण, हमारे डॉक्टर भार्गव जी, बलराम भार्गव जी जो सचिव हैं ICMR के, और सामने बैठे हुए एम्स के डायरेक्टर दिल्ली डॉक्टर गुलेरिया और एम्स जोधपुर के डॉक्टर मिश्रा जी, उपस्थित देवियों एवं सज्जनों, पत्रकार मित्रों, मैं सर्वप्रथम बहुत प्रसन्नता व्यक्त कर रहा हूं कि आज 10 वर्षों के बाद फिर से हमने पुरानी यादों को ताज़गी किया करने का प्रयास किया। शुरुआत में मैं अपने दिल की बात साझा करना चाहूंगा। भारत और स्वीडन दोनों देशों के अधिकारियों को बहुत बहुत बधाई। मैं गर्व के साथ कह सकता हूं कि दोनों देशों के संयुक्त प्रयास ने इस MOU को सार्वजनिक स्वास्थ्य में हमारे सबसे सफल द्विपक्षीय संबंधों में से एक बना दिया है। भारत दृढ़ता से मानता है कि स्वास्थ्य का अर्थ न केवल शरीर का स्वस्थ रहना, बल्कि शारीरिक, मानसिक, आध्यात्मिक और सामाजिक स्वास्थ्य का महत्व है। स्वास्थ्य का मतलब केवल बीमारी या दुर्बलता नहीं है। वर्तमान समय में भारत में स्वास्थ्य के क्षेत्र में अनेक जन कल्याणकारी बदलाव आए हैं। भारत के यशस्वी प्रधानमंत्री श्री नरेंद्र भाई मोदी जी ने नेतृत्व में यह प्रयास किया है और उनके नेतृत्व में हम स्वास्थ्य विभाग को आगे बढ़ाने का काम कर रहे हैं। आज पूरी दुनिया में भारत सस्ती दरों पर दवाइयां उपलब्ध कराने में विश्व के 5 देशों में से एक है। आयुष्मान भारत योजना के स्वास्थ्य के क्षेत्र में जो बदलाव आया है वह अलौकिक और अभूतपूर्व है। माननीय प्रधानमंत्री श्री नरेंद्र मोदी जी के मार्गदर्शन में सर्वे भवन्तु सुखिनः, सर्वे सन्तु निरामया, सर्वे भद्राणि पश्यन्तु, मां कश्चित् दुःखभाग् भवेत्। सभी सुखी हो, सभी आरोग्य रहे, सभी भद्र हो और सभी एक दूसरे की पीड़ा को अपनी पीड़ा समझ करके पीड़ित मानवता की सेवा में लगे रहे। यही हमारी भारतीय संस्कृति है, यही हमारी सभ्यता है। हमारे प्रधानमंत्री श्री नरेंद्र भाई मोदी जी के नेतृत्व में हमारी सरकार ने 2017 में राष्ट्रीय स्वास्थ्य नीति लागू की है। 2017 के स्वास्थ्य नीति में हमारा मूल आधार है सर्वे सन्तु निरामया, सभी आरोग्य रहे। अर्थात आज के इस दुनिया में हम सभी पूरे विश्व को स्वस्थ रखने का हमारी संकल्पना है। इसके आधार पर ही स्वास्थ्य एवं परिवार कल्याण मंत्रालय भारत सरकार देश में सभी उम्र के लोगों के लिए स्वास्थ्य और कल्याण के उच्चतम स्तर को प्राप्त करने के लिए अग्रसारित है। जैसा कि मैंने पहले बताया, हमारी सरकार ने आयुष्मान भारत जैसे कार्यक्रम की शुरुआत इस देश में किया है, जो दुनिया के सबसे बड़े स्वास्थ्य कार्यक्रमों में से एक है। अनूठी योजना है। एक तरफ 55 करोड़ लोगों के 10 करोड़ परिवार और मुफ्त इलाज की सुविधा, प्रत्येक वर्ष 5 लाख रुपया प्रति परिवार, स्वास्थ्य सुरक्षा की गारंटी, ये अपने आप में यह सुविधा दूसरी तरफ प्राथमिक उपचार केंद्रों एवं स्वास्थ्य केंद्रों का कायाकल्प करना, 1.5 लाख हेल्थ एंड वेलनेस सेंटर का 2024 तक हम उसको हेल्थ एंड वेलनेस सेंटर बनाने जा रहे हैं। ग्रामीण स्तर पर लोगों को बेहतर स्वास्थ्य सुविधाएं प्रदान हो सके, यह हमारा दायित्व है। यह कार्यक्रम हमारे देश में इतना लोकप्रिय हो गया है कि लोग इसे मोदी केयर के रूप में भी पुकारते हैं। और सचमुच दुनिया के हर कोने कोने में जहां भी जाने का मौका मिला है, मोदी हेल्थ केयर को, आयुष्मान भारत को लोगों ने सराहा है। ऐसे महत्वाकांक्षी लक्ष्यों को प्राप्त करने के लिए हमें निरंतर सीखने के लिए सहयोग, समर्थन की आवश्यकता है। गुणवत्ता पर अत्यधिक ध्यान देने के साथ साथ दुनिया में सबसे उच्च प्रदर्शन वाली सार्वभौमिक स्वास्थ्य प्रणालियों में से एक की स्थापना में स्वीडन का अनुभव उल्लेखनीय है और भारत के लिए वह सबक हो सकता है। बुजुर्गों की देखभाल, उन्नत प्रौद्योगिकियों के उपयोग और ई स्वास्थ्य पर समग्र ध्यान देने में स्वीडन की सफलता उल्लेखनीय रही है। हम अपने समझौता ज्ञापन के 10 वर्ष का जश्न मना रहे हैं, जिस पर बड़ा हर्ष हो रहा है। 2009 में हमने हस्ताक्षर किए थे। हम इसे भारत स्वीडन स्वास्थ्य वर्ष के रूप में कह सकते हैं। हमने उल्लेखनीय मील के पत्थर हासिल किए हैं, चाहे वह मातृ एवं शिशु मृत्यु दर हो, शिशु स्वास्थ्य के मामले में हो, व्यापक गर्भापात देखभाल की बात हो, स्वास्थ्य में मानव संसाधनों की का प्रशिक्षण हो, बुजुर्गों की देखभाल क्यों न हो। हमने हर क्षेत्र में काफी सफलता प्राप्त किया है और हम आगे बढ़ रहे हैं। हमने पिछले 10 वर्षों के दौरान कई मुद्दों पर एक साथ काम किया है और यही कारण है कि यह समझौता ज्ञापन भारत के किसी भी राष्ट्र के साथ सबसे सक्रिय और सफल समझौता ज्ञापनों में से एक है। मैं बताना चाहूंगा कि भारत ने विभिन्न देशों के साथ स्वास्थ्य के क्षेत्र में लगभग 57 समझौता किया है, लेकिन स्वीडन के साथ समझौता 2009 में हुआ और उसके बाद से 10 संयुक्त कार्य समिति की बैठकों की वजह से यह समझौता सबसे अधिक लोकप्रिय और सक्रिय रहा है। इस उपलब्धि के लिए मैं स्वीडिश दूतावास को विशेष रूप से बधाई देना चाहता हूँ। मैं इसके निरंतर समर्थन की अपेक्षा भी करता हूँ। अब हम AMR, नर्सों और दाइयों, फार्मास्यूटिकल्स और चिकित्सा उपकरणों, डिजिटल हेल्थ केयर और उभरती प्रौद्योगिकियों के उपयोग के विशेषज्ञ प्रशिक्षण में सहयोग के बेहतर माहौल बनाने के लिए भी हम इच्छुक हैं। हमारे पास इनमें से कुछ मुद्दों पर स्वीडन के साथ पहले से ही कुछ समझौता हो रखा है और हम स्वीडन के सार्वजनिक स्वास्थ्य निकायों के साथ साथ इनके लिए प्रमुख चिकित्सा संस्थानों के साथ कुछ साझेदारी करने की हमने उम्मीद जताई है। अंत में मैं आने वाले समय में स्वास्थ्य के क्षेत्र में दोनों देशों के निरंतर बेहतर कार्य करते रहने का और मैं आशान्वित हूँ कि हम आगे के दिनों में स्वास्थ्य के क्षेत्र में दोनों ही देश बढ़ चढ़ करके हम लोगों के स्वास्थ्य की चिंता कर पाएंगे। धन्यवाद। जय हिंद, जय भारत, वंदे मातरम, नमस्कार।
These will be used by startups and the healthcare delivery stakeholders to collaborate and address current and future needs for affordable and NASCOM. I invite the collaborators up to the signing table, who's on the stage, to please join us to witness the signature and also for a photograph.
Up and the core team members to please join us. Ladies and gentlemen, let's have a round of applause towards the start of the week collaboration. I would also like to invite Mr. Vardhan and Mr. Sunil Sharma, Joint Secretaries, Ministry of Health. Thank you.
So those who can't hear, Madam is explaining that this is a tulsi plant, which is a very sacred plant, and it's basil, which is also in India, it's very sacred plant. Whenever any auspicious occasion happens, we
Yeah, HbA1c entirely petrol can be done, blood sugar can be done. So all these tests, they're all made in India. Face today in the country has late diagnosis of chest pain and what happens to the ECG. So here's a connected
This communicator device will transmit, the AI will generate a report and within yes. There are two levels
45 seconds. The AI will and it takes about 6 minutes for it to go. It's fully operational. So this is a G machine and it costs about 1 lakh in entirety as a setup.
We are working with government of Goa on this study project. So with Goa Medical College and different centers where we are by bringing down the time from door to balloon.
We've also introduced this particular breakthrough from China. We've mentored others as well this particular innovation. So it's just a normal G machine that can pay for lips. So G
child health. That's why we have the crystal figure here. It's got every woman, every child, everywhere around India, everywhere around the world. So we started with the innovation with replicability. So you just prick your finger, you fill it with a fluff, you place the analyzer, and you put that in the stuff. So it's very much about mother and child health, about anemia, but also about diabetes, which is a continuous importance. And he only manufactures solutions that are needed in that point of view. Not just because we have, but it has to be needed. That is what we did. We did in India for 10 years. And within 35 plus years, really developed traditional healthcare as well as the rural areas all around the world. Completely portable, yes.
Just want to show you. So this, we are all here and just a trying apps. Yes.
Just for anemia and blood sugar. So we test for anemia and another analysis for blood sugar. And then we have diabetes management, HbA1c, the long-term
These are the things.
We are basically into thermal imaging cameras, sir. So this fantastic device can do wonders. If you can see this, Naveen, can you come here? So he will hold up. I will just keep it on camera. So I'll keep my hand over here. One, if you can see the screen. 2, 3, 4, 5. If I remove my hand, with the naked eye you can't see anything on this. But with the thermal camera you can see. I transfer the heat from my body, and if somebody is having a fever, 0.1 degree variation on this particular camera can pick it up. This is quite expensive as of now, which cannot replace the thermometer. Electrical, mechanical, health problem. You can just put one camera at the gate and you keep on checking whether somebody is having a fever or not. And if somebody is having, you may be asked to leave. This starts definitely infection control through strong infection control, SCCS attack.
Stems from towards global hygiene and health company with major interest across fracture management.
Preventing patients from, and we have a number of disposable catheters which we apply with a coating so that bacteria don't adhere to the surface and grow. 3 no movement together, they create, when they get in contact with fluid, they create a galvanic effect. So imagine sticking your tongue on a battery. What happens? They sit on the surface, they don't multiply, and they don't create biofilm. So we mess with the bacteria, but it's completely safe for patients because we don't release any toxic substances. So we put it on medical devices like these ones. So they are repelled. We don't kill them. We put that because that it's safe and it's long lasting. There's a lot of products like this. We have cooperation with these. So they're testing.
Ms. Maya Fested, State Secretary to the Minister for Health and Social Affairs, Government of Sweden. Mr. Nicholas Jacobson, Deputy Director General at the Ministry of Health and Social Affairs, Government of Sweden. All the distinguished members of the Swedish delegation, my dear colleague Ashwini Chaubeji, my colleague Minister in Government of India, Madam Preeti Sudan, Secretary Government of India, Health Secretary, and Dr. Balram Bhargav, Secretary Department of Health Research, all the other distinguished guests here, friends from the media. Well, a lot of things have been said till now. I don't think I have any more to add to that, but I'm really happy that for the last 24 hours we are all enjoying good meetings, in the company of our very beautiful minister. In the less than 24 hours, this is our third meeting. We enjoyed lunch hosted by the Prime Minister yesterday. In the evening, we enjoyed a dinner hosted by the President of India. And now this is a very, very special, momentous occasion where we are celebrating 10 years of our Indo-Swedish partnership in the field of health. Yesterday we were blessed by the presence of the Honorable Prime Minister of India and also His Majesty the King and Her Majesty the Queen of Sweden, where there was a great innovation dialogue to strengthen our impacts of science for human welfare, of course, health also, because being a science and technology minister also, I feel that if you can really blend the partnership that we have in science and technology and also the partnership that we have in health, we can have far better outcomes. So it's the last 24 hours had been very, very meaningful, and they are certainly going to add a lot of quality to what we are already doing. As has been mentioned by the previous speakers also, and especially our dear minister from Sweden, that this is a unique partnership. My colleague minister from India said we had over 50 partnerships in health, but this stands out as something very, very significant, very, very vibrant, very meaningful, and very much result-oriented, where things are being monitored so well. Every year we have a joint group meeting with Love Agarwal and the team on the other side. They are all actively pursuing all subjects. Yesterday, even at the lunch and the dinner, we were talking a lot about health, maternal mortality, child mortality. I told her that because when we were meeting at lunch, I said, this is the time when I have a bill in the parliament which has to be passed about banning e-cigarettes in India. And at the same time, in fact, I was with her at lunchtime. So after the lunch, I rushed to the Rajya Sabha and we got the bill passed. So today we have e-cigarettes banned in India. And she was very, very positive and receptive about the idea. And she was discussing a lot about what's happening in Sweden, what's happening in India, what needs to be done, how can we really go ahead. And we can now, I think, say that when you go back, you can also try banning e-cigarettes in your own country. So today we are talking of this relationship which is 10 years in health. But while I was sitting here, I was trying to recall my association with Sweden, which goes back to almost 24 years. It was exactly the month of November in 1995 when I was the health minister in the capital itself. And I had a trip to 4 places, a couple of places in America and in UK and also in Switzerland and of course in Stockholm. And we were planning to visit some of the best centers of occupational and environmental medicine, and we were told that one of them belongs to Stockholm also. And that was the time when it was like shivering cold, ice and snow all over the river, and the whole lake was all total frozen. And when we came back to India in November 95, we were in fact inspired to be instrumental in creating the first environmental and occupational medicine clinic in a medical school in New Delhi for the first time in India. And through the school, now through that department in a medical college, we have trained in the last 25 years hundreds and thousands of doctors in this country for environmental and occupational medicine. Last year itself, around the middle of the year, I had the privilege to again go for a meeting where it was a very, very special privilege that in a day we were attending two functions in two different countries on the same day. Morning function in Denmark, evening function in Sweden, and because both of them are so close to each other, and it was a mission innovation meeting with a clean energy ministerial, where you all know that at the Paris meeting for global warming and climate change, this mission innovation movement was born. And our own Prime Minister Narendra Modi had coined this word mission innovation, where the scientists from almost 24 countries, the European Commission, they are all working together to find out newer ways of, you can say, having clean energy research and developing new incubators for clean energy research. And for the first time, in fact, we have created an international incubator for clean energy research in New Delhi itself, in northern part of Delhi, from our Science and Technology Ministry, where scientists from all over the world, they can all participate in that. And India is fortunately part of all the challenges that the mission innovation is working on, with leadership role for at least three challenges there: the smart grids, off grids, and biofuels. So it's a very, very important moment for me. Is again with all the Swedish people. I know that you are all very nice people, very kind-hearted, very loving, very affectionate, very sincere, very polite, very dedicated to your work. So I know that this is not a routine meeting, but this meeting means a lot for us, because for us in health, India is passing through great times. We have fortunately a very, very dynamic and a visionary Prime Minister who has passion for everything that in fact helps mankind, helps alleviate the sufferings of the common people, but he has a special passion for health issues. He has a special passion for science and technology issues. He has a special passion for innovation, and he knows the power of innovation. He appreciates the power of science and technology, and he knows that unless we strengthen health and family welfare, we can't really help people in a big way. So there are a lot of big activities going around in the field of health in this country. You all know we have already eradicated, like the most of the world, diseases like smallpox and polio, and now we are in the process of eradicating and eliminating a number of other diseases like tuberculosis, much before the targets set up by the World Health Organization, diseases like Kala Azar, lymphatic filariasis, measles, and so many others. We are in the process of actively ensuring that we reduce our maternal mortality and the child mortality rates to bare minimum, and every preventable death of child or an infant or a pregnant mother has to be prevented at every cost. That is the spirit with which the country is working. You have heard from our colleagues about the Ayushman Bharat, one of the most ambitious programs of the whole world, where we thought of helping almost 550 million people with so much of support, financial support, and healthcare delivery delivered through over 18 to 20,000 hospitals all over the country. And already in the last 1 year, we celebrated 1 year completion of this very ambitious program. We have almost 60 lakh, that means 6 million people have already benefited from the scheme. You heard about our ambitious program for the health and wellness centers, where we intend to provide these 1.5 lakh centers by the end of 2022, and already money worth $1 billion has been spent on the care of these people who are given the service through these centers. There is a big movement around prevention and positive health attitude development, promotion of health being strengthened, and preventive strategies being strengthened in this country. There is a strong Fit India movement which has been conceived and is being spearheaded with a number of ministries, and of course our own ministry along with the sports ministry participating in that, and also in Eat Right India campaign, where we are promoting that if you eat right and if you eat less, you live longer and you remain healthy. So it's a huge, I think, basket of things that's in which we can further expand our relationship. It's not that what we decided to work together 10 years back, we continue to work in those areas. This relationship has to be continuously dynamic. It's now we are talking of collaboration with 2 aims, but right now almost 22 aims are in the process of development at various places in the country. 157 medical colleges are new medical colleges are in the development phase right now in the country. So there is a huge expansion of the network which provides medical education, whether it's undergraduate, postgraduate, and at different levels. A lot of activities going on in the field of research, a lot of collaborations with the scientific community, with the engineering community for development of cost-effective, affordable medical devices, for the discovery of new drugs, and for the delivery of all these drugs and medical devices, etc., at affordable prices through our, you can say, organized government shops, which we call as Amrit and with other names. So it's so much that's happening in India, and I think with the experience of other countries and more particularly Sweden, we can be of great, immense help to each other. And certainly it's the goal not only for India but for the whole world, which was dreamt of by the World Health Organization, that we have to fulfill the dream of giving a health for all, to not only all Indians but to every person all across the globe. And if we all work together with sincerity, commitment and dedication, I'm sure with the support of the organizations like the World Health Organization and other international UN organizations, and with cooperation from various countries, I think time is not far when we will be standing at a platform where we can look back and say, oh, we have achieved quite a bit. Now the goal is not too far off. So we must go back from this meeting with a new sense of responsibility, new sense of commitment, and a new zeal and energy to do far more, I would say, significant things in the next 10 years than what we could do in the last 10 years. Occasions like this, I think, are the moments when we could reaffirm our faith in each other and also plan for the future. With these few words, I once again welcome our dear minister, our dear colleagues, and all the members of the Swedish delegation. And we assure all of you that India stands rock solid with you in our desire to work together with complete dedication and sincerity. Thank you so much. 10 साल की रिलेशनशिप है और बहुत वाइब्रेंट रिलेशनशिप है. जितने इम्पॉर्टेंट एरियाज़ हैं जिनमें काम करना ज़रूरी है उन सब पे हम लोग मिलके काम कर रहे हैं, चाहे वो एंटी माइक्रोबियल रेजिस्टेंस हो, चाहे वो मैटरनल मोर्टालिटी के इश्यूज़ हो, चाइल्ड मोर्टालिटी के इश्यूज़ हो, सभी सब्जेक्ट्स के ऊपर. डिजिटल हेल्थ है, दूसरी चीज़ें हैं, और फिर ये तो वाइब्रेंट रिलेशनशिप है. वी कीप रिवाइजिंग आवर एजेंडा, वी कीप अपडेटिंग आवर सेल्व्स. और जैसा आज 10 साल सेलिब्रेट कर रहे हैं तो अगले 10 साल के लिए पिछले 10 साल से और बेहतर करने के लिए संकल्प लिया है.
सर, इंडिया इज ऑल्सो ए गुड हब फॉर मेडिकल जो बैक एंड है उनके लिए. डू यू थिंक दैट इंडियन कंपनीज
ऑब्वियसली आज तो मेक इन इंडिया का कैंपेन बहुत बड़ा कैंपेन बन गया है. अदरवाइज़ भी मेडिकल डिवाइसेस के लिए, ड्रग्स के लिए तो भारत ने अभूतपूर्व प्रगति की है. सारी दुनिया को आप जानते हैं कि वैक्सीन्स हैं, ड्रग्स हैं, मेडिकल डिवाइसेस में अभी तो हम दुनिया से बहुत कम रेट के ऊपर और बेहतर क्वालिटी की चीज़ें जो है हम देने के लिए जो है सक्षम हो गए हैं. तो बहुत सारे दुनिया के देशों को हम दे भी रहे हैं. और ये जो रिलेशनशिप है हमारी, विशेषकर स्वीडन के साथ, ये और ज़्यादा जो है इसको प्रधानमंत्री जी ने भी कल आशीर्वाद दिया. इनोवेशन के लिए डायलॉग हुआ, मिलके कैसे काम कर सकते हैं. तो ये अभी सब हमारे यहाँ के अधिकारी और स्वीडन के अधिकारी लोग जो है, हमारे हेल्थ के प्रोफेशनल्स, सब लोग मिलके जो है और ज़्यादा बेहतर प्लान करेंगे.